Hi, thanks for joining me on TOS, The Road to Recovery. My name is Christine. This is my first video that I'm publishing with YouTube in regards to Thoracic Outlet Syndrome. My purpose of developing this channel was I had a really hard time being able to find any information on Thoracic Outlet Syndrome, what are the recommended strategies and treatments. So I wanted to kind of walk you through my journey, bring you along with me, and for anyone that's having questions about Thoracic Outlet Syndrome, at least we have a place to go. Briefly going over my experience until now, about 2 years ago, I felt like I had an injury when I was doing CrossFit workouts. Not very heavy weight, but it started with a pain in my shoulder. It felt like an ache. I tried to keep working out, but just not putting any weight-bearing exercises above my head. And then a week and a half, 2 weeks later, I started developing numbness and tingling in my fingers. There were a variety of diagnoses that they tried, which was shoulder impingement, and I got physical therapy for that. They've done steroid injections into my shoulder. There were a total of 3 rounds of PT. I've done myofascial release treatments, hot therapy, cold therapy, anti-inflammatories like NSAIDs. I've done steroid shots like we had mentioned. I've also done like gabapentin, done a trial of Lyrica, didn't tolerate any of those. So the diagnosis took a really long time, and we've tried a lot of modalities in the meantime and weren't able to be successful. And amongst all the testing, we had shoulder x-rays, chest x-rays, MRIs, the whole bit. And I even had an ulnar nerve transposition surgery on my left side. And that temporarily helped for maybe about 6 weeks or so. And then when I went back to work, I started getting back into my normal routine. The symptoms started coming back up and they started getting worse. So on top of having all these symptoms, I had already gone through a surgery and that wasn't successful. Now, granted, it did show I had scar tissue along my ulnar nerve, but that wasn't the full cause. It wasn't until we did a hydrodissection to make sure that the scar tissue wasn't pulling on the nerve. I also did a trial of acupuncture, and only after that was I referred to a hand specialist surgeon. And the diagnosis of thoracic outlet syndrome was actually seriously considered. And in my area where I was, there wasn't anyone that was really versed in the ins and outs of thoracic outlet syndrome. So at that point, the recommendation was that I go to the Mayo Clinic. So I reached out to them and I found out that they do have a vascular center, and there's actually a thoracic outlet syndrome clinic within the Rochester, Minnesota location. So I went and I wanted to walk you through some of the testing that was done, because maybe you can get some of this testing done where you are instead of having to wait a long period of time and go to the Mayo Clinic to get it done or to another specialist. We were trying to rule out if there were any issues, so they did a lot of repeat imaging. I will say that the imaging quality was a lot better, even if it was a 3T MRI that I had done locally. But the difference between the 3T MRI over there done at Mayo, the clarity was so much greater. So yes, there is a difference, and it does depend on the institution that you go to about what the quality will be. They also did some diagnostic tests. So they did, just to make sure to rule out that there weren't any other issues within the shoulder, they did a lidocaine injection in the shoulder, wanted me to kind of move it around, test it out to see if I had any significant pain relief. I did that and it didn't really make a difference. Another somewhat diagnostic test they do to check for thoracic outlet syndrome specifically was a lidocaine injection in the scalene muscles. So I'm not very well versed in anatomy and physiology, but the scalene muscles are muscles in your neck. And the nerve bundle for thoracic outlet, in your thoracic outlet, that nerve bundle goes in between those scalene muscles. So the idea was if we were able to inject lidocaine, which is a short-acting numbing agent, anesthetic, that if that was able to relieve the pain, if there's issue to nerves or like tightness or compression of those muscles, it would kind of not relax it, but help kind of numb it, if I was able to get improved movement and ability to do things, then that was a good result. And that may also show that surgery may be successful if we do some decompression in those muscles. And they did the injection. It was ultrasound guided. It took a lot more time just to prep it, but I was maybe at a 5 or 6 in pain level when I went into the office. By the time I left that office with the lidocaine injection, my pain was 0. I had a little bit of issues with coordination because of the muscles that were affected, but that wore off maybe after 30 minutes. But I was able to go back to my hotel room and do push-ups and do a plank. And that was stuff that I haven't been able to do in over 2 years because of this injury. So after that, I was able to meet with a vascular surgeon, and that's when we had discussed about getting surgery done. And typically, there are 3 types of thoracic outlet syndrome. The majority, which is about 95% of cases, are neurogenic thoracic outlet. And typically, you can do physical therapy to be able to help open up the area and to get relief. Usually, just physical therapy alone can do it. If you have the venous or arterial versions, which are the less common, you're dealing with more of compression of blood vessels. But the definitive diagnosis isn't given unless you've had a blood clot associated with it. Now, they also did some vascular ultrasounds that they looked at me at rest to see if there was any blockages or stenosis, like hardening of arteries in those certain areas, and everything was fine. But when I would move into certain positions that would normally aggravate thoracic outlet, the blood flow stopped. And I never knew that. We don't have that kind of testing where I live right now. So they were able to test it. And one of the movements was I moved my arm back like I'm about to throw a football. And actually doing this right now, my fingers are already going numb. So they were able to test that and see that there was a compression. So going back to the conversation with the surgeon, normally if you can have blood flow stop, but if there's no blood clot, it's not officially diagnosed as venous or arterial thoracic outlet syndrome. So at this point, we're kind of looking at a mixed condition, but more toward the nerve side. And they said that normally we do not do surgery for neurogenic TOS unless there are certain criteria. And that means have there been surgeries that have been done? Have you done multiple rounds of physical therapy with the correct type of exercises? Gratefully, I had a wonderful physical therapist who had an inkling in the back of their mind when I started PT with them that there may have been some thoracic outlet symptoms that were related. So I was actually getting treatment for those things at the same time, even though I was having a diagnosis of shoulder impingement and all that. And then also depending upon your quality of life. If I had an occasional tingling in my hand, that probably wouldn't merit surgery. But at this point, I was having trouble cooking, washing dishes, doing the laundry, cleaning, getting dressed, driving, going to work and doing my daily activities. And I do a lot of computer work, even with all of the ergonomic changes, of making sure you're sitting right and using like a posture brace or using a standing up work desk. None of that helped. So at this point, we have decided that we are going to proceed forward with surgery. And my next video will be discussing about what are the options with surgery, what are some of the side effects or complications that can come along with it. So stay tuned. Thoracic outlet syndrome can be a very frustrating and difficult diagnosis to receive. A lot of people don't have the answers that you're looking for. You stay frustrated and in pain, and you have to go to specialists where it's not even they can't definitively give you an answer. I know a lot of the questions about the symptoms that I was experiencing, they were not able to give me a clear definition of what was causing it, because thoracic outlet syndrome, there's a very large area where everything passes. And so it's very complicated to be able to diagnose and rule out everything else. But I just wanted to encourage you, you're not alone. You're not making it up in your head. There is a reason for all of this, and I hope that you're able to find the answers you have. If you like this video and are interested in knowing about the details of what's coming up, I will be having surgery next week, and I will be also documenting my post-op recovery and my journey through physical therapy. So if you're interested in any of that, make sure to like and subscribe. Share this page with anyone you think that may be interested. And if you have any questions, feel free to comment below and I'll answer anything that I can. Of course, this doesn't replace any consultation with your provider, does not give a diagnosis, but I'll try to help you as much as I can. Thank you.